Thanks so much, Sarah. As Sarah said, today's conversation is all about family childcare networks. My name is Patty Ryan. I'm with the National Center on Early Childhood Quality Assurance. Our TA Center is jointly funded by the Office of Child Care, the Office of Head Start, and Health Resources and Services Administration. Our center supports the work of states, territories, and tribes in promoting healthy, safe, and high quality environments for children. And we're proud and humbled to work with those of you on the phone today who work diligently on behalf of family child care educators. Over the past year in particular, the recognition of family child care and the importance of family child care in the fabric of our child care infrastructure has grown remarkably clear. Yet too often, family child care educators are faced with challenges and lack access to vital systems of support. What we do know is that many states, territories, and tribes are currently exploring staffed family child care networks as a mechanism to support family child care. Again, we're so excited to have you here and join us in this conversation. And whether you are just exploring the concept of networks, starting a new staffed family child care network, or looking to expand a current network, the conversation we have today will provide you with both useful strategies and resources to help you guide your work. Um, we would like to know how many of you have been on a previous family child care conversation with us. So Sarah's going to pop up a poll right now. If you would please just let us know. Did you attend either the first session on March 31st that was around strategies, or the second session that really focused in on business practices for family child care? And we'll give you just a minute to answer that poll. Thanks. And it looks like about 2/3 of you have been on a previous conversation with us. This conversation today will follow very much the same flow. We'll get started here, talk to you about some of the key takeaways for the conversation today, dive right into the conversation, spend a lot of time listening to folks who are experts in the implementation of family child care networks. And then wrap with some helpful resources for you. Um, you're an important part of this conversation. So throughout the session today, we'll be giving you an opportunity to both share with us via Mentee, and we've used that previously. We'll talk to you a little bit about how to do that. And as always, the chat is available, and we have folks who are actively monitoring the chat to help lift up your voices. And so, Sarah, if you could shift to the agenda slide. Oh, and we're grateful to our partners at All Our Kin, who you'll hear from in just a minute, who are helping us facilitate these conversations. And now, Sarah, if you'd put up the agenda slide, that'd be great. So again, our goal for you today is to walk away with strategies to support staffed family child care networks. You'll hear about strategies for beginning and expanding. You'll hear the key elements, and most importantly, you'll know where to go after you get off the phone for additional help and support. And so many of you in the chat box have already put your name and the state you're from. It'd be helpful too if you told us a little bit about the organizations that you're with and also the role that you fulfill. So if you'll share those in the chat, that would be helpful for us. And again, we're so grateful to our partners at All Our Kin who are so willing to share their expertise and their passion really about support services for family child care educators. And now I'll turn it over to Erica Phillips, who's with All Our Kin, who will take it from here. Erica?
Thank you, Patty. And good afternoon to everyone. On behalf of All Our Kin, we are really excited to partner on this series featuring strategies for supporting family child care, which we know is so essential as we rebuild. I am Erica Phillips, and I am the Chief Impact Officer at All Our Kin. All Our Kin is a national organization that trains, supports, and sustains family child care educators with direct service in Connecticut and New York. We'll share more about our model later during the panel. But first, I am going to share a graphic you may have seen if you attended any of the other webinars in this series. With the Collaborative for Family Child Care and All Our Kin's learnings from the last 20 years of experience with family child care, we distilled the core components of a strong system of support for family child care, which is captured here in a house framework. First, there must be clear standards and tools for accountability so that family child care programs are supported in understanding and meeting health and safety regulations, as well as early learning standards. The next component focuses on the quality of care so that family child care programs have access to resources and support they need to deliver high quality care to children. Third, there must be support for strong business practices. And the fourth component of the house is that there must be systemic supports so that family child care educators are connected to each other and to stakeholders across systems that can offer tailored resources, information, and support. Finally, you'll see that there are two components we've pulled out on top of the house since they're so critical to all the other components. Specifically, centering equity and ensuring sustainable financing are central to all strategies to support family child care. So today we're going to talk about family child care networks, which can touch on many components of this framework. But we started here to emphasize that one individual strategy is not enough to support family child care. We need to address every component in this house. With that said, let's find out a little bit more about what we already know about family child care networks. We're going to share two polls. So the first question we're asking is, what could you fit, or I'm sorry, what stage are you at in the implementation of a staffed family child care network? Just exploring, planning stage, we're up and running, or we're looking to expand our services? So leave the poll up for a minute as people let us know where you're at in implementing a staffed family child care network. Great, so it looks like most people are just exploring, and then a few more people at the planning stage, with a few who are either up and running or looking to expand our services. So you are in the place to be if you're exploring and at the planning stage. And we'll tap on people who are up and running and expanding to help contribute to all of our knowledge. So the second question we want to ask, particularly for people who are up and running, or maybe even if you are planning, what support services does your staffed family child care network currently provide? And I believe you can select all that applies, and feel free to do ones that you're either currently providing or maybe planning to provide, because I know most people were in the planning phases. It's also okay if it's I don't know at this point, and we'll hope you have a little bit better sense of this by the end of today's webinar. Looks like you may only be able to select one. And if that is the case, we are sorry about that. We'll take the one, and it still gives us helpful information. So thank you all for completing it, and apologies for only being able to select one. All right. Great. So there is a lot of interest, or the services being provided, most popular on professional development, followed by QRIS coaching and consultation, and business support coaching and consultation. Great. And seeing a few other services, a few other networks are doing family childcare recruitment and licensing support, or the subsidy payment. And please feel free to add additional things that you might be doing in the chat. Well, thank you for doing that, so we could see the diversity of experiences and approaches in this group. Please keep the comments coming to share what you offer or what you're interested in hearing more about. Before we move into the panel, we want to share 6 key takeaways for our session today on family childcare networks. First, family childcare educators must be included in network design and provided ongoing opportunities for family childcare leadership and feedback. We'll hear strategies for engaging family childcare educators in all stages of developing a network. This is such a crucial step, since family childcare educators are best equipped to determine what they need so they can focus on caring for their families. Second, the core elements of family childcare networks include vision, staffing, program, funding, and policies, all undergirded by principles and values. By going through these elements, you can clearly design family childcare networks for family childcare educators in your state. And while all networks should have a clear vision, staffing, and program, the next takeaway is that the actual form of a network can take many different shapes. Networks may be hosted by standalone nonprofits and organizations, CCR&Rs, shared services, provider associations, or childcare centers. And the specific form should be tailored to the community and responsive to family childcare educators. However, there does need to be a minimum threshold of services to make an impact. And so during the panel, we'll get into what type of staffing and services need to be present in networks. The fourth takeaway is that successful family childcare networks are built on strength-based relationships and centering equity. Strong relationships and trust are important for any system, but it's especially important in family childcare, since most family childcare providers are very isolated. They're doing this work from their home, which can feel deeply personal and private to the provider, and often their interactions with systems are only punitive. But we want to change the narrative with family childcare networks. So building relationships and being strength-based is very important. It's also important to center equity and ensure the network is accessible to all family childcare educators, and we'll get into specific ways to do this during the panel. The fifth takeaway is that family childcare networks are one part of the childcare solution for families and educators. So going back to that house, we also need sustainable funding and rates, payment rates, inclusion of family childcare in all early care and education systems, for example. Finally, we'll outline the type of supports available to help you through this. As you will hear today, there are examples and resources you can use to get started on family childcare networks in your state. This is just a preview, and our panelists will elaborate on all of these takeaways and more. So I am happy to introduce our panel moderator, Marina Rodriguez. Marina is the co-director of the New Haven, Connecticut Family Child Care Network and Early Head Start Network at All Our Kin. She has also served as a family child care licensing coordinator, a coach for family child care educators, and a mentor for others coaching family child care educators. Welcome, Marina.
Thank you, Erica. What a lovely introduction. I am gonna go ahead and ask also our panelists to introduce themselves before we go ahead and dive into this very important conversation about Staff Family Child Care Network. Tony, would you mind introducing yourself?
Sure, Marina, thank you so much. I'm Tony Porter, and I'm with Early Care and Education Consulting in New York.
Thank you, Tony. Jessica?
I'm Jessica Sager. I'm All Our Kin Chief Executive Officer and thrilled to be here with all of you today.
Thank you, Jessica. Tanya?
Hi, everyone. Good afternoon. I'm Tanya Harden, and I'm with the Louisiana Department of Education, and I manage our family child care strategy. And it is a pleasure to join today.
Thank you, Tanya. Natasha?
My name is Natasha August Williams, and I am a provider, mentor, and educational coach for All Our Kin, but I was a former provider for about 8 years.
Thank you, Natasha. Well, thank you all for being here today and introducing yourself. This conversation is very important. We are going to talk about family childcare networks and the effectiveness of the family childcare networks as the nation begins to take a closer look at the strengths of family childcare and family childcare networks. So I am going to go ahead and start with Tony. Tony, can you tell us a little about the research you've done?
Yes, thank you for the question. So the Erickson Institute and Early Care and Education Consulting conducted the National Study of Family Child Care Networks. And it consisted of 3 primary components: a national survey of 156 networks to map the network landscape, interviews with 47 directors of 47 networks, and in-depth case studies of 2 promising networks. So the link in the chat, I believe the chat has links to all 3 reports, I think. So we define networks as organizations with paid staff that deliver a menu of ongoing services to educators. We found that networks take many shapes, as Erica indicated. They can be offered through child care resource and referral agencies, large umbrella organizations such as social service agencies, freestanding organizations like All Our Kin that do this work exclusively, and through Head Start or Migrant Head Start. We found that networks that are embedded in the community, deeply knowledgeable about the strengths of family child care and the providers, educators' experiences doing this work, and that offer culturally responsive and sensitive services have the potential to address the twin challenges that our field faces: increasing supply and improving quality. The decline in the numbers of family child care educators is serious and scary. The 2019 National Survey of Early Care and Education found a 25% decrease between 2012 and 2019. This is a huge equity issue. Many low-income families who disproportionately rely on family child care for their infants and toddlers, care during non-traditional hours, and care in rural areas may now have limited access to these settings. Quality is an equity issue as well. We depend on family child care educators to support children's positive development, to prepare them for school and for life. Yet research has consistently shown that family child care quality is low compared to that of centers. There are problems with this research, but that's for another day. One of our overriding findings is that any network services should be driven by the needs that educators articulate rather than some top-down agenda. That these services should be offered in the languages that educators speak, and that they should be respectful of educators' experiences. These feel like no-brainers, but they are often overlooked. Now, we only have limited evidence, Marina, about network strategies that improved quality or increased supply, but our research suggests 5 promising strategies, and Erica kind of previewed them. They include high-touch coaching visits 2 or more times a month, formal opportunities for peer support through provider or staff-led support groups or one-on-one mentoring, business supports such as training workshops, parent referrals, and collection of parent fees, and financial support to offset costs associated with compliance with system requirements, retrofitting homes for licensing, background checks, CPR, and first aid training, tuition for college courses or credentials. Their list goes on and on and on. The 5th is helping educators navigate increasingly complex licensing, subsidy, and QRIS system requirements through support with the huge amounts of paperwork and the technology, the online applications and documentation that's frequently used. And finally, some research points to the value of providing comprehensive services and a curriculum.
Yes, yes, I definitely resonate with a lot of that stuff and have noticed how a lot of the coaches spend so much time helping educators, particularly navigate higher ed systems, particularly for educators also who don't speak the language. So a lot of what you mentioned deeply resonates with me as a person who's been doing this work for a very long time. Thank you, Tony.
You're welcome.
Jessica, All Our Kin has been running staff family childcare networks for over 20 years, I should say now. Can you tell us about the outcomes you've seen?
Sure thing, Marina. And it's so good to be here with you and with Tony and with Tanya and Natasha today. So as you noted, All Our Kin has been partnering with family childcare educators for 20 years. So I know some of you here are just building networks. We know how hard that is, but we know it's doable because we've built a lot of networks. We began in New Haven, Connecticut, and today we work with over 1,000 educators, reaching roughly 6,000 children in cities across Connecticut and New York City. Here are some of the results that we've seen when we take a strengths-based approach that values family childcare. First off, we've seen an increase in supply. As Tony referenced, family childcare has been closing at an alarming rate across the country, even before the pandemic. However, during the first 10 years All Our Kin was in existence, we saw the supply increase by 74%. Second, Tony spoke about quality. I want to be really clear that family childcare programs can provide wonderful high quality care as long as, like all programs, they have access to training and support. So we've seen those increases in quality. All Our Kin's programs score over 50% higher on research-based observational tools, such as the Family Childcare Environmental Rating Scale. And by the way, Tony did that study. Thank you, Tony. We also have promising initial findings on child outcomes when we look at children's language and literacy, problem solving, and social emotional skills. Third, there's a significant impact on the workforce. Educators in our network earn $5,000 more after 1 year with us, $10,000 more after 2. And each newly licensed family childcare enables 4 to 5 parents to enter and remain in the workforce. The combined impact on educator and parent earnings results, according to the University of Connecticut, in an ROI of $15 to $20 for every dollar we spend.
Thank you, Jessica. That really does sound like a no-brainer to me to invest in family childcare. As a follow-up question, what are the key elements of a family childcare network?
Yeah, so Erica spoke about a lot of these in her introduction, but we've actually made a graphic to make it a little easier to understand. So maybe we can bring that up now. Fantastic. So I'm going to talk through this, but I hope that those of you on the call will spend some time digging in and reflecting on it later. So we've broken it down into 5 key components and 3 really central principles. So the first thing to think about when you're building your network, as with any big project, you have to have a vision. What is it you want to accomplish for educators, for children, and for families? What is your theory of change? What are the things you're going to do, and what's the difference you're going to make? The second, guiding principles and values. If you take nothing away from this conversation today, but this is the single most important thing, the how of engaging family childcare educators is almost always more important than the what. So to treat educators with respect, to build authentic relationships, to think about how to be equitable and inclusive, and to start from a strength-based place of valuing the work, that will make sure that you start by listening to educators, engaging with them, and building something that actually meets your community needs. Third, holistic and responsive programming. So once you listen to educators and find out what they need, build programming that will meet those needs. And if those programs don't work, we do this all the time at All Our Kin, think about how to change them. Make sure that your professional learning opportunities are rooted in theory about how adults learn, as well as sharing content about how children learn. So that means fun, interactive, hands-on, engaging, offered at hours that educators can attend, accessible to those for whom English is not a first language, and once we get back to in-person meetings, in a place that educators can actually get to. It's also really important, and you've heard this already, you have to support educators and as business people so that they can earn what they deserve and build businesses that will last. Next, supportive funding and policies. Part of your job in building a network is making sure that network will last. And that means working to secure public funding and/or philanthropic dollars so that those programs can stay open. It means making sure that your subsidy program is structured so that it's worth it for educators to do this work. If you are a state child care administrator, you can do that yourself. If you are an advocate, you can work with your administrator to make it happen, but the money always is going to matter at the end of the day. And knowledgeable and dedicated staff. So staff who know about kids and who know about family childcare. Staff who are skilled in building relationships and who can take the time to have a cup of tea and listen and reflect, are trained in reflective practice, and have the time to continuously learn and develop their skills, as with any other member of your professional team. And we're going to talk a little bit more about the specifics of that later. Finally, again, the how. Start with the strengths-based, build on the amazing work that educators in your community are doing already, form authentic relationships, center equity. So really think about whether these programs work for educators across different demographics, particularly those who have traditionally been excluded, and elevate educator leadership, because educators will be your single best partner in building a network that's successful.
Thank you, Jess. That was very comprehensive. And as the poll demonstrated earlier, there are many people on this call that are just getting to build the network, out. And so, Tanya, I have a question for you. What was your startup process? What did that startup process look like in Louisiana?
Well, our startup process was very unique. And it started back in 2012, actually, with the passing of Act 3 in our state, which unified the entire early childhood care and education system under the Department of Education and the Board of Elementary and Secondary Education. This work was comprehensive work, but it did not include family child care. They were left out of this equation. However, lots of research showed that many children in our state were being cared for in family child care homes, but there was little done to support this field at the time. And then our pilot came about once we were awarded our initial preschool development grant. A group of invested stakeholders consisting of folks from our R&Rs, some family child care educators themselves, some of members from our statewide Early Childhood Advisory Council members and Louisiana Policy Institute. So these folks gathered together to create and conceptualize this pilot to move this work forward. And our state decided at the time to contract with our CCRNRs, our Child Care Resource and Referral Agencies, to provide the services and support for the pilot. This we felt was the best fit because of the existing relationships that our RNRs had within the communities already. They would support our family child care providers back in the day before Act 3 came about. So it was really important to continue to build on these existing relationships. And finally, we just began our third year of this pilot, and it's our final year as well. And the department is currently in the throes of revising our CCRNR RFP, which will take effect next school year. And at that point, everything that we've done in the pilot will be scaled statewide. So this is an exciting time for us and for family child care in our state.
Wow, yes. Congratulations. Do you consider that a big win?
Big win, but we have so much more work to do.
Absolutely. Thank you for sharing that. Yes. Natasha, question for you. As a former educator yourself and now a mentor and coach of educators, initially when you were an educator in this field, what made you join a network?
I opened my program on my own. I had no idea there was any support out there. And I found like 2 pieces of mail from All Our Kin. I never heard of them. I thought it was a scam, so I tossed it in the trash. So the next time I received the mail, there was a training on birth to 3, and I'm very interested in birth to 3 because that was the age that I had enrolled in my program. So I drove to New Haven. It was about 30 minutes away. Because I was interested, the distance didn't matter. So I got there and the training was amazing.
Can you tell me, when you walked into the door, how did you feel? What was that like for you to walk into All Our Kin? How did that feel for you?
One thing that really got me when I walked in is the smile of the young lady who opened the door. And after 10 years, I call her Smiley because I will never forget that smile. And I met you, Marina, and you gave me the biggest hug, even if you didn't know my name. And another thing I love about All Our Kin, the network, by the second time they see you, everybody know you by your name. So I felt so welcome. I felt like I was part of a network, and I kept on coming and coming because it was so touching for me to see other people care about my work.
Well, we love you. We love you, Tosh. And like, you're now a mentor for other educators. That's amazing. So as family childcare networks are developed, we know it's important for family childcare educators to have a role in the design of networks. Tanya, you spoke a little bit about your work and what this looked like a little bit, but can you tell us how are you engaging educators in your state?
That's a great question. And one thing I want to be really clear about for anyone listening is that it is key to authentically involve educators throughout this process. So they were involved at the very startup of the pilot, the conceptualization phase, we call it. They were on that work group alongside other dedicated stakeholders. And we really welcomed and valued their feedback in creating this pilot. And I think that they felt that their feedback was welcomed and valued, and that's important too. And we continue to engage our educators through questionnaires, through surveys, getting input on what types of supports they feel are most valuable and what's still missing, what they feel is still very needed and necessary. And perhaps the most impactful way that we engage our educators in our pilot in this state is through focus groups, and which happens monthly, and their monthly network meetings. That way they discuss different trends going on in the field, what's going on. And as a department employee, I'm able to communicate different things that are very valuable to them. And there's a very reciprocal relationship that we've developed, and we're authentically just getting their feedback along the way. And I really believe that they feel really brought into the situation. I share with them things, state level information, things that are pertinent to them. And I feel that overall, they feel their voices are heard and their voices are being valued. And it's very important.
Yeah, I wholeheartedly agree with that. Educators are experts in their own context.
Absolutely.
With that in mind, we're gonna pop up a Mentee question for you all to engage with us. So the question is, how do you ensure family childcare educators are at the table when designing and implementing services like those offered through family childcare networks? The code, as you can see on the screen, the questions on the screen for you, and also the code for the Mentee is on the screen for you as well.
And I would recommend, if you have a smartphone, you could just pull up, go to www.mentee.com and then add this in so that you can see the responses as they come up. Or you can open up another browser window and go to www.mentee.com. And the code is 5535087.
We also added that on the chat for you.
Great, I see a response. So I think people are in and able to respond. So hearing, make sure they are compensated for their time. Yes, yes, absolutely. If you're asking them, they potentially have to step away from their roles. And so absolutely making sure they're compensated. So you seek their input in ways and times that are accessible to them. Inviting different providers who are at different levels. Yes, yes, I know we've been pushing multiple providers, so not just one, so they can represent different levels of business experience. Two-way communication is very important, which Tanya talked about that. Great, liberatory design methodology, absolutely. That's a great way to partner. Regularly scheduled surveys, also assessment surveys, cohorts. I think you can keep using it, but these are great responses. And I don't know if you want to get back to the next question, but thank you all.
Yes, thank you for sharing all the wisdom. Thank you, Erica, for navigating that with us. So we know, like as in family childcare, there are many right ways to carry out care and provide education. So networks offer a variety of services for family childcare. Natasha, can you share an example of a network activity you participated in and how that impacted you as an educator or as an entrepreneur? And how has that changed over time?
I participated with tons of network. All our kin couldn't get rid of me. I was in everything because I just wanted to keep learning and learning and learning. But one of the biggest thing that I did was the business series, because as a family childcare worker, I find that a lot of people, they don't appreciate your work. So a lot of families, they took advantage because you don't have a strong contract, you don't have a strong handbook. So you go word of mouth, and in a business that doesn't work. So I had a lot of people take advantage. And one thing that really helped me is when we did the business series and they asked, who are you? And I started as a duck, being timid. And at the end of the class, I was a lion. I was roaring. I had a strong contract. I had a strong handbook. I had a website all done by All Our Kin. And I made $150,000 that year. And I'm like, holy moly, thank God for All Our Kin and the business series. And I got my CDA, my Child Development Associate with them. And I got, I kept on going, and I got my first national accreditation, first in Fairfield County, and I felt so blessed, and because of All Our Kin. And let me tell you, they pay for all the fees. Everything is free. They said America don't have free things, but everything, All Our Kin is free. And the food, every class that you come, there's delicious food served. I'm like, I don't have to cook, and I don't have to feel, hungry, because they think about us like children. If you're hungry, you can't learn and you can't participate. So there's the food, you get time to eat, and then you get time to sit and learn. And that was very, very touching for me as a network to do all of that for free, and they care about you.
Thanks, Tosh. We really value community, and breaking bread together is definitely certainly part of that. Tanya, so how did you decide about the services that the network in Louisiana is going to provide? Like, how did you get there?
Well, some of the ways we developed and thought through these services were through our state's CCDF plan. We wanted to make sure we adhered to the plan that was already in place, but also Erickson Institute's research was referred to as well. So that was a lot of good information in there as we started this meeting off with a recap of some of that, which was wonderful. But some of the services we provide, which there's a whole wonderful laundry list. We do provide one-on-one and job embedded coaching at least twice a month. And our coaches recognize the importance of relationship-based coaching. So these coaches were selected by their R&R specifically for this trait. There's monthly group training and network meetings provided. This is a wonderful time for our educators to collaborate and connect as peers. They find so much value in network meetings. They no longer feel isolated as a result. And these ladies through this pilot project, through these network meetings and trainings, have truly formed, as they call it, a sisterhood. And they value this time together and the relationships they've built with one another. Also provided, we provide infant and early childhood mental health consultation through Tulane University's TICE program. So these services are for educators, for children and their families. There's mental health training provided, support for developmentally appropriate practices, behavioral needs and concerns, and also support with administering screening tools. As you can imagine, our educators were very apprehensive of having anybody really enter the home. They have been operating in isolation for so many years, with the exception of some of the R&Rs maybe coming in, doing a little spot check visit here and there, but they were increasingly apprehensive to receive mental health support, the stigma that goes along with that. But over time, in building relationships, because the mental health consultants as well know the value of forming relationships with our educators, but they truly have made such a difference. And now our educators they brag and have such relationships with their consultant. But also, because I can talk on forever, we measure support, our quality of supports through FCRS, the Family and Child Care Environmental Rating Scale. And we also use our class tools, and we specify and we create individualized supports from this data that we collect using these tools. And for their full participation, we offer our providers and our educators, a stipend. And we realize that, they need to have more stable and reliable funding each month that they can depend on and they can budget for. So this really helps to fill in some of those gaps. Of course, it's not enough. Our first year participants also receive an environmental enhancement grant. So we know that there's a lack of funding for family child care learning homes, and they're really lacking a lot of educational material supplies. So this helps them to purchase some of the most needed learning materials. And we also use data to determine what's needed in the home. So we use the data from our FICers in class to sit down and make a game plan, educator and coach on what is needed in the home to purchase. And we go from there. This year, we plan to incorporate a few new initiatives into our pilot, and it's super exciting. We plan to bring on curriculum, also a childcare management software. We've gone with Wonder School. We want to support our educators in that iron triangle model of full enrollment and full fee collection. I think it was Natasha who just talked about the All Our Kin and all of the services and support that they provide as well. So we, myself and my family child care coaches attended the All Our Kin virtual business series, Train the Trainer, which was phenomenal, by the way. Thank you, All Our Kin. And they really pay a lot of attention to adult learning theory, because I really felt everything that Natasha was saying. They did an awesome job to detail. But we've gone and gotten this knowledge so that we can offer this series to our educators, which I think will help to change their lives. And they've, since me coming aboard, they've been talking about how this is such a need. Business, strengthening their business practices is really an area that they really speak of as a need. So we're so excited to help fill that need for them. The department also does plan to continue exploring licensing for family child care in our state. Some of you may know we're one of only 2 states in the country without a licensing option for family child care. So that is something that we're still trying to do through this strategy, and very at the forefront of what we're trying to do. And also entering FCC's, entering the state's accountability system. That is something we're planning as we continue on in this 3rd and final year of our pilot. So lots, and that's just a good snippet of what's going on and what we're planning. It sounds very overwhelming, but we're kind of just piloting some of these initiatives with small groups at a time of educators, as not to overwhelm them. But we are super excited about everything that they're going to get to experience.
Yeah, I mean, it certainly sounds like they're being held in a really supportive way.
Yes.
Kudos.
Thank you. Thank you.
Jessica, we know that too often groups of family child care educators have not had equitable access to resources, including family child care educators who speak different languages other than English, or immigrant, Black, Latinx, Indigenous family child care educators, and family child care educators in rural communities. A key tenet of All Our Kin's framework is centering equity and justice. What recommendations do you have to ensure that this is done?
This is such an important question, Marina. Thank you so much for raising it. I think the key is to be really intentional and mindful about potential barriers and biases, and building in ways to address them. So some of these are, first and most centrally, questioning biases about family childcare. There's often a knee-jerk assumption that family childcare is a second best option. Family childcare educators may not be included in state preschool funding or other initiatives focused on quality. And yet, as we know, many family childcare educators do a fantastic job of offering quality care that is rooted in the nurturing continuous relationships that are so essential for children's development. So look around at all the programmatic offerings in your state. Are you including family childcare? And if not, how can you think about including family childcare educators as full participants? Second, thinking about the flow of information. So who is getting the information about grants, resources, training, network services? How are you sending that out? Are you ensuring that the information is available in multiple languages, that trainings and information are available to those using smartphones, that your language is welcoming and accessible, that your staff interacts in a respectful way with each participant, and finally, that you've structured applications to include family child care educators. Third, thinking about staffing. Does your staff come from the community you serve? Do the staff reflect the demographics of the educators? Is your staff trained in cultural competence, and is equity a core tenet throughout your organization? And finally, I've said it again and again throughout our time together, listen to educators. Are you hearing directly from educators? Are you hearing about barriers you may unintentionally be creating? Do you have a strong enough feedback loop and enough trust that where those barriers may exist, you're sure you're going to hear about them? And when you do hear about them, do you act promptly to reflect on and correct imbalances? It's a work in progress, but if you are super intentional about these things, I think you'll find that it moves towards a more equitable, inclusive system overall.
Yes. Yes to that. With that, we're going to move into another Mentee question, and Erica's going to help us move through that again. And the Mentee question for you now is, what strategies is your state, territory, tribe using to recruit new and retain existing family child care educators?
It's a great question. And again, if you just joined us, you can pull out your smartphone or open up another browser and just go to www.mentee.com, and the code is 5535087. Maybe we can put that back in the chat for people. I think it should automatically prompt to this question if you answered beforehand. This is also a great way to hear ways that you are getting buy-in. There was a good question in the chat, and so we can all add into that. So one-on-one coaching, yes, that really gets to the relationship building pieces and really getting educators engaged. While we're waiting for people to respond, I will just, I think third, there was already a cosign on the business series, but as someone who has started a few family childcare networks, that always seems to be a great way to recruit new educators, because we're always looking for new ways to improve the business, and then you can share all the other parts of the network. So I see networking opportunities. Yes, support navigating the licensing process. It's great if you're starting right at the beginning. Sometimes those processes can feel a little opaque for licensing, and so having a network to support somebody is very helpful. See a couple of things. Grants, providing assistance with grants and support is very useful. It looks like a great program, Imagine You. I didn't, which pairs experienced family childcare mentors with people who want to become licensed. That is great. That is an amazing program. These are great ideas. Absolutely. Local CCR&Rs. For the question, Imagine You, if you want to put in the chat, where is that program at? It sounds like a great program. Thank you, Kate, for talking about, for sharing about Imagine You. We'll definitely look into that. Great. Thank you all for sharing these ideas.
Thank you all. We're going to move into talking a little bit about staff, the staff of family childcare networks. Natasha, this question is for you. What is it that you appreciate about the staff at the network?
Great question. What I appreciate that the staff was very helpful. Another thing that I love about the staff that they're very transparent. So if you have an example like you have a question and they don't know the answer, they will find the answer. They will connect you to resources. They're going to ask another staff. If you have a business question and I ask my educational coach, she's going to ask the business team, and they will get back to you the next day as quickly as possible. If you have any troubleshooting, a challenging situation with a family, they're there to help you and navigate you through how to talk to that family or how to talk to that child. And also the relationship that you build with the staff. You can walk in and your printer is not working and somebody's always there to help you print how many copies that you need. And I've never seen anybody get annoyed. They're always there with a smile to help you with anything that you need. And even like if you run out of an idea for a curriculum, your coach will get a book or curriculum material. And she was very creative, so she had some great ideas on how to get things done and how to teach the children with, you don't even have to spend any money, recyclable things. And I love that about the staff.
Thank you, Tosh. Sounds like you made like real deep connections.
Yes, I did, for life.
Tony, can you help us understand what are the important characteristics of a network staff?
Marina, I think Natasha and Jessica and also Tanya have all answered this question. So I'll just hit the high points that everybody has already said. So relationship-based practice, trusting relationships that are grounded in mutual respect, reciprocal communication, and shared goal setting is foundational. Okay, that's clear. Then staff who reflect, these are all repeats, staff who reflect the cultural, racial, and linguistic backgrounds of the educators and the families they serve is crucial for engaging and retaining educators. And I can't stress that enough. That's one of the things that we learned in our case studies. That was a real pivot point, distinguishing characteristics of networks that were effective in engaging folks and those that were not. Oh, here we go, Jessica, is intentionally culturally responsive practice. Okay, there's that. And an element that I don't think anyone has talked about actually is helping staff address the tension between playing dual roles as monitors and supporters, especially if the network is responsible for subsidy compliance or licensing compliance in some way. And that becomes a real challenge for providers because for staff, because they really need to figure out whether they're going in with their checklist or whether they're going in with their checklist to help. Then we also found, and I think Jessica mentioned this, I'm almost positive, we found that staff training, support, and supervision are important for helping staff establish and maintaining relationships with educators. And I think, as someone mentioned, training topics should include working with adult learners, because we know that many folks who come to do this work with family child care know how to work with kids, but they don't necessarily know how to work with adults, and that's really important. And also that many folks who may come to this field may be coming from a center focus and don't really understand family child care, so it's important to really convey that as well. And finally, and I'm calling out to Jana, who's here someplace, regular and reflective supervision is really important in helping staff improve the quality of their interactions, which results in more effective quality improvement among educators.
Yes, thank you for that.
That's what I had to say.
Yeah, I totally agree. I think it's imperative to create those parallel conditions of psychological safety, right? If staff feel safe, then they feel safe to work and so on. So thank you for naming that. We are going to move to funding, and we understand sustainable funding is critical to family child care networks. Tony, this question is for you again.
Yeah.
What did you find to be the most common source of funding for networks?
Okay, and this is from the national survey of 156 networks, and you remember that included child care resource and referral agencies, networks housed in social service organizations, freestanding networks, and Head Start programs. So we found that public funding was the primary source for networks. So Whoopi, what does that tell us? Well, what that tells us is for the R&Rs and the networks that were housed in social service organizations, state CCDF funding, Tanya, this was in the old days, the set-aside funding was the primary source for those networks. And for Head Start, the networks in Head Start clearly was Head Start, which was federal funding. We also found that some networks, agencies relied on their child care and adult food program dollars, the administrative portion they could use, that they had if they were food program sponsors. And then a couple of interesting things. We did find that a small proportion of networks actually relied on parent fees. We didn't explore that. Yeah, we didn't explore that in the study, but we learned later through network directors that what that really represents is that the networks that manage the subsidy programs collected the subsidy payments for parents and then used a share of that for their administrative overhead. So that's a kind of, I don't know if it's anything that anybody necessarily wants to use, but it's something. And then finally, there were some networks, and I know it sounds like, Tanya, you're using Wonder School, right? Okay. There were some networks that depended on provider fees, and it was networks like Wonder School, which basically charged fees to the providers for those back office supports. So lots of potential here for the new federal funding.
Yes, yes, lots. Tanya, really quick for you, what funding sources are you using for your networks?
So our funding for our network mostly is our preschool development grant, Birth to 5, and also CCDF funds. But with new federal dollars, there was a lot of thoughtful stakeholder engagement that went on to planning how we can now use some of that federal funding with ARPA and CURSA dollars to move our family child care work forward. So we definitely will be using a lot of those funds to invest back into family child care. But long-term family child care, once they're fully incorporated into the CCR-NAR, and we scale this model statewide, will be completely funded long-term through CCDF funds.
Wow, great.
Yeah, exciting. I want to name for all of us that we're using a lot of acronyms. So the audience, if you are experts in the acronyms that we're utilizing, please, kudos to you. And if you're not, ask questions in the chat for us to explain them for you.
Thank you.
Good point.
Yeah, absolutely.
Got about it.
Tony, what closing comments do you have for the audience from a research perspective?
Well, did you want me to talk about the methods for evaluating the impact of networks or my closing comments?
I think we're going to the closing comments.
Okay, great.
I want to interject really quickly, Tony, if you could include a little bit of evaluation in your closing comments, that would be great.
Okay, I can. I can pivot. Okay, so I'm a researcher. I can tell you, I can give you evaluation 101 in about, I hope, 3 minutes. There are a couple of different design strategies you can use. One, but basically they fall into 2 buckets. One is qualitative, and that's going to resonate with a lot of what Tanya was saying, where you use interviews and focus groups to understand the perspectives of family child care educators, and you can use that, I'm going very fast, for a variety of purposes. Another is quantitative, and that involves surveys, which Tanya uses too. Thank you for being on this call, Tanya. Surveys, and also direct observations of quality. And there are lots of resources available for you if you want to engage in either of these strategies. I have 2 points I want to make before I give my closing comments. One is that as a researcher, it's really important to focus on the implementation of the pilot or your network before you do anything to look at the outcomes that you're anticipating. Because unless you know what your model looks like, you will not be able to attribute any of the findings of its effectiveness back to that model. It could be some other thing that somebody learned off the net or something like that. So that's one thing. The second thing is that we all want to get to child outcomes because that's what everybody wants us to show. And that's a really hard thing to get to. It's labor intensive and it's very expensive. And so that's why the field as a whole uses provider quality as a proxy. So that's my little Patty teeny, and my closing comments relate to this. As a researcher, I have a simple answer for you, Marina, but maybe not so simple. Networks have enormous potential, and we now have this opportunity to learn what they do, how they do it, and what works for educators, children, and families. Any initiative that we fund should include a strong evaluation component to help us better understand which networks make a difference and which combinations of networks make a difference. And any research that we do should include the educators and the families we propose to study. They should be at the forefront in the choice of the design, the research questions we use, and the analysis of the findings. That's my final comment.
Thank you. Powerfully stated. Tanya, what advice would you have for state leaders thinking about implementing family childcare networks?
The strongest piece of advice I think I can give would be to engage family childcare educators in this process every step of the way, and as soon and as early as possible. And when I say engage, I mean to authentically engage them, meaning not coming with a preconceived set of ideas or a plan that we want to push our agenda forward and get them to sign off on, but really and truly coming to the table with an open mind and open ears, ready to listen to what they have to say, and truly open to that and incorporating that into your strategy and into your plan. And another piece of advice I think I'll give also is once we've listened and we know we've got a sense of how they feel and how things would work best for them, and when we develop these networks, being prepared to advocate on their behalf. Too often they don't have a seat at the table. So when we do meet with them and we're hearing their voices, to be able to carry their voices, strongly advocate for their behalf. And I can go on and on, but I'll cut that off right there. But those are my two strongest pieces of advice.
Thank you. I absolutely agree with you. Something as simple as having meetings at night and not having a meeting at 9 o'clock in the morning when they are actually about to serve a snack or go into.
Absolutely. The nighttime and the weekends are like my extended hours.
Right. Yes.
To meet their needs.
That's exactly right. So Jessica, staff family childcare networks it's an important solution for families and educators. In your opinion, what other supports are necessary to sustain and strengthen family childcare in our country?
Great question. So in addition to creating all these wonderful staffed family childcare networks, I would say there are 4 key things. The first is to create a truly mixed delivery system for children 0 to 12 that includes all of the settings where children are cared for. So that means building a system that includes childcare centers and family childcare and family, friend, and neighbor care. I would also say as part of that, paying special attention to unmet needs that also includes infant toddler care, non-standard hours care, and care for children with special needs. Second, we absolutely must increase compensation for educators, especially family childcare educators, and provide funding directly to them, especially now through stabilization grants and other mechanisms. Networks are never going to substitute for inadequate resources. Third, expand eligibility for families for subsidies to help pay for care and streamline the process for accessing those dollars. And finally, as I have said again and again through this panel, ask educators and families what they need because they are the true experts and their input is critical to shaping an inclusive, effective, equitable childcare system.
Yes. Natasha, as an educator, your perspective is so important. What advice do you have for CCDF administrators on this call who are implementing or exploring or expanding family childcare networks in their states or territories?
Thank you, Marina. First, I must say, oftentimes when you share that you have a family childcare, everybody just brush you off and they change the subject. And that annoys me because I have to show pictures and say, this is what I do. And I always have to defend myself. So as a family childcare providers, we wear so many hats at the same time. We're an educator, we're a chef, we're a nurse, we're an entrepreneur, and a family worker. So we are often left alone for hours. Sometimes my first child used to come at 4:30 in the morning, and I don't close about 6:30, and I have to attend network meetings to learn a little more about childcare. We care for children for the most important years of their lives, 0 to 3, 0 to 5, actually, not even 3. And we do that because we love teaching, we love the children. And I would love network to recognize us and support all of those hats that we have and recognize that we are not babysitters. We are educators. We are most times are the children first teachers.
Thank you, Tosh. That was really powerful. I just want to wrap up our conversation now. Just, taking my hat off to you all. Thank you for taking time out of your day to join this conversation, this imperative conversation. And I am going to hand it over now to Erica, who's going to move us through the next section. Thank you again.
Wow, thank you so much. I am so grateful, and seeing some of the comments from the chat, I think everybody here is really appreciative of the information that all of you shared. So thank you, Jessica, Tony, Tanya, and Natasha. And thank you, Marina, for facilitating this conversation. As we're wrapping up, we have a few questions for you, and you can put this in the chat. So the first question is, what is one thing you heard from the panel discussion that resonated with you? The second is, what have you learned that will be valuable for others to know? And the third is, what are you curious to learn more about? And so please take a few minutes to put your responses to the questions in the chat. Thank you all. I will say I've learned things from all of you here today in what you're doing in your states. Yes, family childcare definitely needs to be heard and involved in building these networks. So while you're putting things in the chat, if we could go back to our key takeaways slide. And I just want to call out a few things that I heard going back to our key takeaways. So the first one, which I already saw in the chat, which is family childcare educators need to be included in the design and provided ongoing opportunities for family childcare leadership and feedback. And I just want to call out Tanya in Louisiana. You did a great job of explaining how you're doing that. The word authentic is sticking with me, and will be something we should all be aspiring to. And so making sure that educators feel their voices are heard and being valued. And at some point you said open mind and open ears, which I thought was just really great. So thank you for bringing that key takeaway to light. The next key takeaway, which was that the core elements of the family childcare networks include vision, staffing, program funding, and policies, all undergirded by principles and values. Jessica walked us through these 5 components for family childcare networks, and also emphasized the importance of listening and engaging the educators. And I'm not sure if we can drop the link to those core elements in the chat, but that was very helpful, Jessica, to hear that laid out. And Natasha and Tanya, you also talked about how those specific services offered by networks, PD, consultation, all of those different pieces really lead or are dependent on having thought through those different elements of a family childcare network. Our third takeaway is that networks can take many forms and should be responsive to the community. However, there is a minimum threshold of services to make an impact. And Tanya and Tony spoke really eloquently about this. So Tanya, you talked about the building on existing relationships by piloting with the CCRNRs, and CCRNRs can be great hosts for family child care networks. And good luck as you scale statewide in the next step in your pilot. And Tony, you really laid out the research in terms of what does a network need to provide. So high touch coaching with multiple touch points per month, peer support or one-on-one mentoring, business supports and financial supports, and helping educators navigate systems like the QRIS or technology, and also providing support for comprehensive services and curriculum. So thank you, Tony, for providing some research and information about what networks should be providing. We also heard a lot about the next takeaway, which was that successful family child care networks are built on strengths-based relationships and centering equity. So Natasha, I remember when you said by the second meeting, everyone knew my name. And I was so touched that there was someone who cared about my work. And so I think that's something that we want all family child care educators to feel when they're engaging with family child care networks. And Jessica, thank you for talking about reflecting and checking biases, and really making sure that family child care educators, feel honored and respected in the work that they're doing. And then Tanya, you also talked about the next takeaway, which was that family child care networks are just one part of the important part of the child care solution for family child care educators. And Tanya, you were talking about making sure that family child care educators have a seat at the table. And sometimes that means that we need to advocate on their behalf, not just for family child care networks, but for all of the other supports that they need in order to be successful. And Jessica, you're saying that networks are not a substitute for inadequate resources. And we should all remember that as we continue to move forward. So finally, there is support available to help you. There is a manual put out by ECQA. Homegrown also has a compendium of services around family child care supports, and there are many partners. And so I know we'll share more information about where you can get more resources, but thank you so much, Patty.
Erica, before you log off, there was a question in the chat that I'm not sure if you have time to address now. We talked a lot about including educators in the design of family child care networks. Somebody asked about including parents and families in the design and implementation of the network. So that was an interesting question that I thought I'd see about your response.
Absolutely. So at All Our Kin, we have done focus groups with families when there were new programs, particularly ones that will touch them very closely. We also have our family coordinators, particularly with our Early Head Start program, who have very close connections with families, and will gather them to provide feedback about the services that we are providing to family child care educators. The last thing that I would say that we've done around involving parents is working in partnerships with providers. And so providers are really the best contact to families. And so what's professional development, or what type of resources can you give family child care educators so that they're going and getting input from their families and then bringing it back. And we've experimented with some trainings and fun ways of engaging there. Are there any other ideas, either from people on the panel? I know there are a number. Yes.
I have an idea. Actually, it comes from our case studies. Networks can actually work directly with families. When we talk about the comprehensive services that we think networks can provide and that are very valuable to families, those comprehensive services can be available through the family child care educator, or they can be delivered directly to the families themselves. And I also want to say that it's really important to include the family's perspective, because you can learn from families. They provide a slightly different lens, and they're going to tell you about their experiences in family childcare, which may help you better understand what educators are telling you, and also how you can better meet the needs of that entire population.
Can I chime in really quick? This is Marina. Really briefly on the families, yes, I agree with Tony 100%. And also, I would be really vigilant that the work toward specifically design and specially crafted towards family childcare does not get mixed up with families. There are already a lot of services that are out that get created for families, and family childcare networks are designed specifically to them and speak to them directly. And so you might want to be really intentional in how you navigate that so that they don't get lost. Just wanted to add that.
Really important, really, really important. And you can talk to 8-year-old kids too. So.
Before we move on, I just want to really, really briefly say that a part of our project, Louisiana State University has been collaborating with us from the beginning to conduct a statewide study on our pilot program with FCCs. And a major piece of their information gathering is through parents. So they want to know why parents have chose family childcare compared to different types of care in our state that's offered. And they also want to know the types of progress children have made over time being a part of a family childcare learning home. So many other pieces of information being gathered, but that is a piece of the study and the information that we're collecting through LSU, our partners.
Thanks so much. And I'm afraid we only have 5 more minutes. So I did want to share with folks the resources, Erica, that you mentioned, and also let them know where they can go to get additional information. So you did hear a lot today, but there's a whole lot more to hear and to learn about staffed family childcare networks. So if you want to follow up with any of the conversation that you heard, we'll put our email again in the chat. A couple people have asked about the PowerPoint and recording of this webinar. I do want to tell you that that will be made available, and we also have another video that's in the works that will be made available, and we'll share all of the resources that we're going to talk to you about in the follow-up as well. And so Sarah, if you just very quickly want to share the technical assistance manual slide and the cost estimation model, that would be great. There are 2, and we'll put the links to these in the chat and also make them available. There are 2 great resources, especially for the many of you that are just getting started, that can help guide you as you make your decisions. One is a TA manual to support staffed family childcare networks, and that has helpful templates, examples, and suggestions for you to use. Jessica mentioned a theory of change. It can walk you through the development of a theory of change, as well as includes things like sample job descriptions from our partners at All Our Kin. And it really does take you through all stages of implementation, from exploration to installation to initial and then final implementation. And the question about how much is this going to cost came up a few times in the chat, or how to figure it out. The network cost estimation tool that we have in conjunction with the user's guide helps you to really determine what resources you'll need based on the intensity of the level of service you'll be providing and also the unique needs of family child care educators in the communities that you're serving. And again, please remember that these resources are available to you, but technical assistance through the National Center in partnership with our colleagues at All Our Kin is certainly available to help you. And the next session for these conversations will be September 8th, and it's about financing a system of supports for family child care. And I want to thank you all for your time, and especially our partners with All Our Kin, Erica, Tony, Natasha, Jessica, Tanya, and Marina. Um, all of you for your time and your expertise. And I'm going to turn it over to Sarah, who will walk you through a few polling questions. And again, thank you all for everything you do on behalf of family child care educators. Sarah.
Thank you, Patty. And I am going to bring up 3 evaluation questions that we have. And so you should see them on your screen now. And there's 3 questions if you scroll down within that pop-up. And these are just 3 evaluation questions that we have for today, asking about your understanding of the material that was presented. How likely are you to use one of the strategies or practices that were shared today outside of this webinar? And again, with the resources that we shared today, how likely are you to use those going forward? And I will just reiterate what Patty said, thanking everyone, our moderator and our panelists today, Patty and Erica. And I know we are right at time. So I hope you all have a wonderful afternoon. Thank you for joining us today. Bye.